Good afternoon and welcome to today's webinar, MRI Bioeffects, Safety and Patient Management. My name is Kelly Baer and I'm the Creative Design Manager with Marketing Communications at IAC. Before we begin, I'd like to take a moment to review a few technical matters and let you know how you can participate in today's session. We would like today's webinar to be interactive, so we encourage you to submit questions. To do so, use the Questions tab located on the left side of your screen. Please submit your questions anytime during the webinar, as we will be monitoring questions throughout the presentation, and we'll try to answer as many of them as possible during the Q&A period. Also on the left side of your screen is the Resources tab. Click on this tab for links to today's handout, a PDF copy of these PowerPoint slides. Select the file name to download the handout. Lastly, in the lower left of the player, please note the Request Support button. If you experience any technical problems during the course of this webinar, you may click this button. A technical expert will be there to assist you with any issues you may have. For those who like to take notes during the presentation, look to the right of the slides and click the Notes tab. There you will see a white text box where you can take notes on today's webinar. These notes will be emailed to you automatically at the end of the session. To be eligible for the ASRT CE credit, you must be registered, logged into this webinar, then complete the survey. The survey will open automatically at the conclusion of the session and be available from the IAC Pro Libraries website for 3 business days. If you are viewing this webinar in a group, please be sure you are also individually registered and logged into this webinar on another computer or device so that we have record of your attendance today. Today's presentation is being recorded and will be posted at a later time for on-demand viewing. This webinar is a joint presentation of IAC and MetroSense. And now I would like to introduce today's guest speaker, Dr. Frank Shellock. Dr. Shellock is a physiologist with 30 years of experience conducting laboratory and clinical investigations in the field of magnetic resonance imaging. He's an adjunct clinical professor of radiology and medicine at the Keck School of Medicine, University of Southern California, the Director of MRI Studies at the Biomimetic Microelectronic Systems, National Science Foundation Engineering Research Center in the University of Southern California, and the founder of the Institute for Magnetic Resonance Safety, Education, and Research at www.imrser.org. As a commitment to the field of MRI safety, bioeffects, and patient management, he created and maintains the internationally popular website www.mrisafety.com. With that said, I will now turn the webinar over to today's speaker, Dr. Frank Shellock.
Hello, and welcome to the webinar entitled MRI Bioeffects, Safety, and Patient Management. This program presents essential information pertaining to the use of MRI technology with an emphasis on the safety issues associated with the electromagnetic fields used during magnetic resonance imaging. Besides conducting laboratory and clinical investigations, one of my primary areas of interest is to train MRI healthcare workers, such as radiologists, MRI technologists, physicists, and others, on the topic of MRI safety and patient management. The utilization of MRI procedures continues to increase, and scanners constantly evolve. Therefore, in order to avoid problems or issues associated with magnetic resonance imaging, it is vital for you to have a comprehensive understanding of MRI safety information and to update, revise, and add to your existing guidelines and procedures in consideration of the latest information. This presentation includes recommendations and guidelines obtained from the latest peer-reviewed literature and documents developed by the Food and Drug Administration, the Intersocietal Accreditation Commission, or IAC, the American College of Radiology, as well as other organizations. As you know, magnetic resonance imaging is a diagnostic technique that uses non-ionizing radiation to obtain images of the human body. During the performance of MRI, the patient is exposed to 3 variants of electromagnetic radiation: a powerful static magnetic field, time variant or gradient magnetic fields, and radiofrequency energy. These electromagnetic fields are essential to the operation of the MR system. Importantly, if these fields are used at excessive levels, they can interact with the patient's body and potentially produce undesirable physiological effects. However, for the vast majority of the hundreds of millions of patients that have undergone MRI exams, only a small percentage have experienced problems which have included minor to serious injuries and a few fatalities. In general, these incidents occurred due to improper uses of MRI technology and/or from not following appropriate safety guidelines and procedures. Today I'm going to present information related to the bioeffects of the static, gradient, and RF fields used during MRI and discuss procedures to help prevent problems and issues associated with these electromagnetic fields. So let's begin with a discussion of the bioeffects associated with the static magnetic field. The introduction of MRI technology as an imaging modality in the early 1980s is responsible for a substantial increase in human exposures to strong magnetic fields. The magnet of the scanner is characterized by its large size and the highly homogeneous field that exists at its center. These magnets are typically large enough to surround even the largest adult human subjects, although smaller magnets designed to image only the head, extremities, or other body parts are also utilized for clinical MRI exams. In general, the bioeffects and safety concerns related to the static magnetic field are always present because the magnet used for a superconducting MR system, which is the most commonly used scanner, is always on or energized. So what are the bioeffects associated with the short-term exposures to the powerful static magnetic fields used by MR systems? Well, to date, there are no known serious or irreversible physiological changes related to short-term exposures to the magnetic fields that are utilized by commercially available scanners. However, there have been injuries and a few fatalities associated with MR systems that have mainly occurred due to the accidental introduction of ferromagnetic objects or implants into this setting. For example, large items such as steel oxygen tanks and wheelchairs have caused serious injuries and at least one fatality in the MRI setting. These incidents are referred to as missile or projectile-related accidents. In addition, exposures of patients and other individuals to MRI scanners have resulted in serious injuries and fatalities due to the presence of ferromagnetic aneurysm clips, ferromagnetic foreign bodies, conventional cardiac pacemakers, insulin pumps, and other implants and devices. There have also been several reports of particularly intense static magnetic fields, such as those operating at 3 Tesla or higher, causing undesirable side effects in certain patients and individuals. These reported unwanted side effects have included vertigo, headaches, nausea, metallic taste sensations, and other physiological changes. However, these physiological effects do not last or persist once the individual moves away from the high field strength MRI scanner. As I previously mentioned, one of the potential problems related to the static magnetic field of the scanner is the missile or projectile effect. This refers to the capability of the fringe field of the magnet to attract a ferromagnetic object, drawing it rapidly into the scanner by considerable force. Obviously, the missile effect is one of the more critical safety issues related to the static magnetic field because accidents can occur that result in serious injuries. In addition, the scanner may sustain damage due to the impact from a large ferromagnetic object. This figure shows a stylized depiction of the fringe field of an MR system. The fringe field is represented by the lightly colored area. Note that the fringe field extends in a three-dimensional manner from the scanner in all directions, including above and below the MR system. Therefore, ferromagnetic objects may be attracted in a variety of different situations related to where the fringe field is located relative to the scanner. Now let's take a look at a few examples of accidents caused by the missile effect that have occurred at various MRI facilities. These particular accidents occurred at different MRI centers when floor cleaning equipment was brought too close to the scanners. Obviously, this type of equipment should never have been allowed into the rooms housing the MRI systems. Besides being dangerous to custodial staff and other individuals, these accidents caused considerable damage to the scanners, which resulted in costly repairs and downtime for the MRI facilities. Because a relatively large ferromagnetic object may be attracted and then attached to the MR scanner by great force, it is frequently necessary to quench the magnet in order to remove the object if the MR system is using a superconducting magnet. In this accident, an extremely large hospital bed became a projectile and is now firmly attached to the powerful magnet of the MR system. Note the immense force that is evident as this huge bed was lifted up off of the floor. Here's an accident that involved a missile effect that recently occurred in India. 2 employees sustained serious injuries when they brought a large steel oxygen tank into the scanner room. Besides the fact that serious injuries occurred, this entire situation was further compounded because the 2 employees were trapped between the MR system and the oxygen tank for nearly 4 hours because the quench button could not be activated. This emphasizes that MRI facilities must have policies and procedures in place to quickly respond to accidents involving the missile effect, including having proper guidelines to follow regarding quenching the magnet in the event that an individual gets stuck between a large ferromagnetic object and the scanner. MRI healthcare professionals should know where the emergency shutdown control is located and how to activate it in case it is necessary to perform a controlled quench of the MRI system. The important guidelines to follow in order to prevent missile-related accidents include the following. First and foremost, all individuals working in and around the MRI facility must undergo proper MRI safety training, and this training should be repeated on an annual basis. Additionally, you should routinely review all MRI safety policies and procedures set forth by the MRI Center and its medical director. You must understand that the powerful magnetic field associated with a superconducting magnet is always on, and therefore the dangers are always present. In general, never allow equipment, devices, or other objects containing ferromagnetic materials into the MRI system room. Importantly, before staff members and other individuals are allowed into the MRI environment, they must undergo a proper screening procedure to ensure that there are no problems or issues that might pose a hazard in this setting. The screening procedure is also performed to ensure that all ferromagnetic or other inappropriate objects are kept out of the scanner room. Besides being attracted to the magnetic field of the MRI system, objects such as external hearing aids and cell phones may be damaged by the static magnetic field. Also, the static magnetic field can erase items that use magnetic storage media such as bank cards and credit cards. Therefore, these objects are also not permitted into the scanner room. In order to prevent patients or research subjects from taking personal items or other objects into the scanner room, it is vital to make sure that they always wear gowns or scrubs that do not have pockets. A primary aspect of ensuring safety in the MRI environment, that is, the area in and around where the scanner is located, is to control access to this physical area. MRI facilities may implement a variety of techniques to control access to the MRI setting, especially with regard to the entrance that leads to the MR system room. Of course, one of the best ways to control access to this area is to have an MRI safety-trained healthcare professional physically present to monitor the area in order to prevent entry by unauthorized individuals and to ensure that no unsafe items are allowed into the scanner room. Other techniques that may be used to control access include the use of special door locking mechanisms to regulate entry into the room and to display danger signs that should be located in and around the MRI entrance. Some MRI facilities utilize special ferromagnetic detection systems that are capable of identifying ferromagnetic objects in order to control access into the MRI setting. Also, certain MRI centers implement the zone method of controlling the MRI setting, as described by the American College of Radiology. Here are some examples of signs that are often used in and around the scanner rooms. Proper signage should clearly state, danger, this magnet is always on. These signs may also include additional warnings about medical implants and other objects that may pose hazards to the patients and individuals entering the MRI environment. As I mentioned previously, some MRI facilities use ferromagnetic detection systems that can easily identify ferromagnetic objects in order to help prevent accidents and injuries related to these items. This slide shows several examples of such systems as they are utilized to monitor the entrances to scanner rooms or placed in other areas such as the patient preparation room. While the use of a ferromagnetic detection system may be a great tool to help with screening, keep in mind that you still must conduct a thorough and comprehensive screening procedure on patients and other individuals before allowing them into the area of the MR system. Currently, there are 3 major manufacturers of ferromagnetic detection systems: Top Development, Metrosense, and MedNovus. The next topic I'd like to discuss is the bioeffects associated with the gradient or time-varying magnetic fields used during magnetic resonance imaging. During MRI, spatial localization is accomplished with the use of gradient magnetic fields, which are turned on and off at rapid rates, at varying frequencies, and at different peak amplitudes. According to Faraday's law of induction, the exposure of a conductor to time-varying magnetic fields will induce a voltage. By placing the human body, which is the conductor, within the scanner and rapidly switching the gradient coils on and off, 2 results are simultaneously achieved. Not only is a gradient magnetic field created, but there is also the potential for inducing voltages within the patient's tissues. Therefore, during the MRI exam, the gradient magnetic fields may stimulate nerves by inducing electrical fields in the patients. In general, the faster and stronger that the gradient magnetic fields are, the more likely they will induce substantial currents in the patient's body. The reported threshold for the production of peripheral nerve stimulation is approximately 60 to 70 Tesla per second for normal subjects. However, for patients undergoing MRI, this threshold may vary depending on underlying health conditions and other factors. During the performance of an MRI exam, the levels of gradient magnetic fields that produce severe comfort or pain should obviously be avoided. Fortunately, at the levels currently used by clinical MRI systems, harmful biological effects associated with the time-varying magnetic fields are highly unlikely. Acoustic noise is another possible MRI safety issue associated with gradient magnetic fields. This noise occurs during rapid alterations of currents within the gradient coils, which creates motion or vibration of the coils as they impact against their mountings. Acoustic noise is typically manifested as loud tapping, knocking, or other sounds that vary according to the MR imaging parameters. Because excessive noise is known to be one of the most common causes of hearing loss, whenever there are loud noises present, it is important to provide patients and other individuals with hearing protection. If healthcare professionals or other individuals must remain in the scanner room during the MRI procedure, they should always wear proper hearing protection in order to prevent problems associated with acoustic noise. Now let's move on to the bioeffects associated with radiofrequency energy. During MRI, RF energy is used to excite protons. As the patient absorbs a portion of the transmitted energy, tissue heating may occur due to resistive losses associated with certain MRI operating conditions. Therefore, localized and/or whole-body heating are the primary safety concerns associated with RF power deposition. The dosimetric term used to describe or to characterize the absorption of RF energy is the specific absorption rate, or SAR. SAR is the mass normalized rate at which RF power is coupled to biological tissue and is indicated in watts per kilogram. The SAR information is used by regulatory agencies with regard to safety guidelines for the exposure to RF energy that occurs in an MRI procedure. The amount of RF power deposition that is associated with an MRI exam is a complex function of numerous variables. These variables include the transmitted RF frequency that is used, the type of RF pulse that is applied, the repetition time, the type of transmit RF coil that is utilized for imaging, the type and volume of tissue contained within the transmit RF coil, as well as other factors. The thermoregulatory changes that human subjects exhibit in response to exposure to RF energy are predominantly dependent on the amount of RF power that is absorbed, and the actual physiological changes that a patient experiences, that is, the temperature rises, is dependent on the surrounding environmental conditions. That is, the temperature and the relative humidity of the scanner's bore. the patient's thermoregulatory effectors are not capable of dissipating the heat load associated with MRI, heat will accumulate and it is stored, resulting in an elevation in local and/or overall tissue temperatures. Since I'm on the topic of MRI-related heating, I'd like to discuss other aspects of MRI procedures that may induce excessive temperature increases that can result in minor, moderate, or even severe burns. Here are a few examples of burns that occurred in association with MRI exams. These cases of excessive temperature rises that caused burns were related to the presence of conductive materials that were in direct contact with the patient during the MRI exams. Of note is that excessive heating and burn injuries can occur for certain implants and devices, even when the scanner is operating within recommended SAR levels for RF power deposition. Implants or devices that have an elongated shape or form a closed loop of a certain diameter may especially present increased hazards for burns in patients undergoing MRI exams. However, burns have also occurred in patients in relation to the presence of inappropriate electrocardiographic electrodes and medication patches that contain metallic foil components. Therefore, special precautions must be taken when these types of devices or situations are present. In several instances that have yet to be adequately explained, patients have been burned during MRI exams without the presence of conducting materials. Here's an example in which the patient received a severe burn in association with an MRI exam. Notably, this patient was in direct contact with the transmit RF coil that was used for the MRI procedure. The prevention of excessive heating and burns in association with the use of MRI requires an understanding of special safety criteria for patient management. The guidelines that should be implemented by all MRI facilities to prevent burns may be reviewed at the website www.mrisafety.com. Remember, it is particularly important to prevent the direct contact between the transmit RF coil and the patient's tissue. To accomplish this, you should always place insulative material between the patient and the transmit RF coil. The establishment of thorough and effective screening procedures for patients and other individuals is one of the most critical components of a program that guards the safety of those preparing to undergo MRI exams and protects the individuals entering the MRI area. Because many of the MRI accidents have been due to deficiencies in screening methods, especially with regard to preventing potentially problematic objects from entering the scanner room, it is crucial for MRI facilities to have appropriate procedures in place for screening. Another important aspect of protecting patients and individuals from MRI-related injuries and accidents involves a complete understanding of the factors that may pose hazards for various implants and devices. Healthcare professionals who are specially trained in all aspects of MRI safety are responsible for screening patients and other individuals. These healthcare professionals should understand the potential hazards associated with the information contained on the screening forms and have inclusive knowledge of the relevant safety information. Proper screening involves the use of a written form and a verbal interview that are designed to identify health conditions and other items, such as implants, that may pose safety or other related problems. So exactly who needs to undergo MRI screening? Well, basically, anyone who will encounter the MRI setting, and that includes patients, radiologists, MRI staff members, family members and visitors, research subjects and volunteer subjects, as well as many others. In order to ensure that there are no current MRI issues related to a change in the medical status for these individuals, especially if an implant or device was recently placed, the screening procedure should be repeated prior to each MRI encounter. While MRI technologists and imaging nurses tend to be the ones who commonly conduct screening procedures, in fact, it is the radiologist at the MRI facility who is ultimately the person responsible for making the final decisions regarding important MRI safety matters, especially in cases that may be complicated or challenging. Therefore, radiologists at your MRI center have an obligation to acquire the knowledge base that is necessary to ensure a safe MRI environment. As I previously mentioned, Screening involves the use of a printed form to document the procedure. After the patient or individual completes the form, a verbal interview must be conducted by a healthcare professional specially trained in the field of MRI safety. During the interview, the information on the screening form should be reviewed to verify that there are no factors present that would pose a hazard. By requiring the completion of the screening form and interviewing the patients and individuals to verify the information, the MRI facility will make certain that healthcare conditions or items that may pose safety issues or other problems will not be missed. Therefore, the screening form asks important questions to determine areas of concern that must be addressed prior to allowing entry into the MRI environment. The Institute for Magnetic Resonance Safety Education and Research developed two separate forms for the purpose of MRI screening, one for patients and one for other individuals that may need to enter the MRI setting. These forms are available to your facility and can be downloaded from the website, MRIsafety.com. The preservation of a safe MRI environment requires healthcare professionals to be particularly attentive to the management of patients and individuals who have implants and devices. For this reason, a considerable part of the MRI screening procedure involves identifying the presence of these items. For patients, MRI procedures may be contraindicated primarily because of problems associated with movement or dislodgement of a ferromagnetic implant or device. Additionally, lens forces, which is when an object that is non-ferromagnetic but made from conducting materials moves through a magnetic field, resulting in forces that may be felt by the patient. This is important to remember for patients with large non-ferromagnetic implants, such as total knee or hip replacements, because these patients may feel tugging or pulling on the implant as they are being moved into and out of the bore of the scanner. By slowly moving patients with large implants into and out of the MR system, issues related to lens forces can be prevented. There are other possible hazards related to the presence of a metallic implant, including the production of excessive heating, especially for objects that are relatively long or for those that form a closed loop of a certain diameter. For some implants, usually those that are electronically activated, electrical currents may be induced under certain MRI operating conditions. Also, the operational aspects of a device may be changed, or the device can be temporarily or permanently damaged in association with an MRI procedure. Finally, artifacts may be present that can either compromise the diagnostic use of MRI, or the artifacts may be misinterpreted as an abnormality. Because implants are developed on an ongoing basis, it is necessary to obtain the most current information about these objects in order to ensure safety for patients and other individuals. Currently, there is MRI information available for implants and devices that is accessible at the website MRIsafety.com. In general, MRI examinations should only be performed on a patient with a metallic implant or device if it has been previously tested and demonstrated to pose no hazards. And it is important to understand that the safety aspects for a given implant or device are generally specific to the MRI conditions that were used to test the item. This information is typically provided in the labeling or instructions for use for the particular product. In 2005, labeling terminology was developed for medical implants relative to the use of MRI by the American Society for Testing of Materials International. This terminology was subsequently adopted by the Food and Drug Administration and other notified bodies and is currently applied for the labeling of implants and devices. Because there is often confusion regarding MRI labeling terminology and how it is applied to medical implants, an editorial that goes into great detail to explain this information was published in Radiology in 2009, and you may access this information on the website www.imrscr.org. The current terminology used for MRI labeling of implants and devices is as follows. The term MR safe refers to an item that poses no known hazards in all MRI settings. This would essentially be an object that is made from non-conducting, non-magnetic, and non-metallic materials such as plastic, glass, or silicone. A good example of an MR safe item would be a Foley catheter made from silicone. The term MR conditional is used to describe an implant or device that has been demonstrated to pose no known hazards in a specified MRI environment with specific conditions of use indicated. The term MR unsafe means that the item is unsafe under all MRI operating conditions. Examples of unsafe devices would be a pair of scissors or a scalpel made from magnetic materials, or a neurostimulation system for which testing demonstrated that it would be unsafe for a patient to undergo an MRI exam. Medical implants are commonly divided into those that are considered to be passive, meaning that they have no active components such as vascular clips, stents, and heart valves, and those that are active, which are those implants that have electronic components such as pacemakers and neuromodulation systems. Now let's take a look at MRI information for various implants and devices. The presence of an intracranial aneurysm clip in a patient referred for an MRI procedure or an individual that needs to enter the MRI environment represents a situation that requires extreme care and caution. Some clips are made from magnetic forms of stainless steel, which are unsafe because excessive magnetic field interactions may displace or move these clips and cause serious injuries or fatalities. By comparison, aneurysm clips made from materials that are non-ferromagnetic or weakly magnetic have been tested and shown to be safe for patients undergoing MRI exams at field strengths up to and including 3 Tesla. In consideration of the current information for aneurysm clips, the following guidelines are recommended. The aneurysm clip should have been tested at the same field strength that will be used for the intended MRI exam. Specific information about the aneurysm clip must be known. And importantly, this information must be documented. For aneurysm clips, the referring physician or implanting surgeon and the radiologist are ultimately responsible for making a decision to scan the patient or not. There are many different types of embolization coils, vascular filters, vascular stents, as well as stents used for other clinical applications. These implants come in a wide range of sizes and shapes and are made from a variety of materials. It should be noted that coils, filters, and stents are developed on an ongoing basis. Because of this fact, there should be no general safety policy applied to these implants. As with all implants, the standard of care is to identify the particular type of implant that is present in the patient and then to determine if an MRI procedure may be performed based on the most up-to-date MRI labeling information. This is particularly important because over the years, the MRI labeling information may change or be revised. MRI testing has been performed on many of the most commonly used coronary artery stents, such as the Cypher, Taxus Express, Endeavor, Driver, and Multilink stents. These tests included assessments of magnetic field interactions, heating, and a characterization of artifacts. The findings from the test resulted in MRI labeling that indicates that patients may undergo MRI exams at 3 Tesla or less immediately after these particular devices are implanted. Many other bare metal and drug-eluting coronary artery stents have also undergone similar MRI evaluations to support MRI labeling claims. This information may be found at the website MRIsafety.com as well as at other websites for the respective manufacturers. Orthopedic implants are often encountered in patients referred for MRI exams. This class of devices represents some of the largest metallic items that are surgically implanted in patients. The main concerns for orthopedic implants include magnetic field interactions and MRI-related heating. For most of the orthopedic implants that have undergone MRI testing, there do not appear to be substantial problems as long as the specific MRI conditions that are found in the labeling are carefully followed. Orthopedic implants classified as external fixation systems can pose serious hazards to patients, even if they're made entirely from non-magnetic materials. External fixation devices come in a variety of configurations depending on the indication for patient management. These orthopedic devices are tested for MRI issues on a configuration-by-configuration basis. Some are safe and some are unsafe depending on the configuration and the MRI conditions that are present. Because of this, it is vital to refer to the specific MRI labeling information for a given external fixation device in order to ensure patient safety. Now take a close look at this serious injury which occurred in a patient wearing a cervical fixation system. During the MRI exam, this patient received multiple burns at the points where the titanium pins from the fixation device contacted his skull. This illustrates the fact that extra care must be taken to ensure patient safety when scanning patients with external fixation systems. You must always follow the FDA-approved labeling and specific guidelines for a given external fixation device. In the past, the presence of an active implanted device was generally considered to be a strict contraindication for a patient relative to the use of MRI technology. However, because comprehensive studies have now defined acceptable conditions for certain devices, there are now several active implants that are acceptable for patients undergoing MRI, including at least one bone fusion stimulator, certain programmable infusion pumps, certain cochlear implants, various neural stimulation systems, and in fact, there are now even cardiac pacemakers and at least one cardioverter defibrillator, or ICD, with MR conditional labeling. In addition, there are now cardiac monitors and recorders that have been labeled MR conditional. Please be advised that the availability of the active implants with MR conditional labeling varies depending on geographical considerations, so that not all of these devices are currently available in the United States. With regard to active implants, in each case, what you'll see is highly specific conditions that must be followed in order to ensure that MRI examinations are performed without hazards in patients with these active implants that have the MR conditional labeling. For example, you'll need to follow instructions with regard to the acceptable static magnetic field strength, the type of transmit RF coil that must be used, the SAR level or RF power deposition that must not be exceeded during the exam, and possibly other MRI-specific conditions. In addition, a particular implant configuration or placement scenario or special programming instructions for the device may be required. At the present time, several neuromodulation systems have FDA-approved labeling that allow MRI procedures to be conducted in patients under highly specific conditions. It should be noted that some of these neurostimulation systems indicate that MRI procedures can only be performed at 1.5 Tesla using a transmit-receive head coil, and therefore, only MRI of the brain exams are allowed in patients with these particular devices. Recently, new devices called the SureScan MRI Systems, which are used for spinal cord stimulation, became available from the manufacturer Medtronic. This new platform for spinal cord stimulation includes specially designed pulse generators, shielded leads, and a new programmer. Patients with the new SureScan MRI spinal cord stimulation systems are allowed to undergo MRI at 1.5 Tesla, and there are no restrictions on the body part, so that this device is considered to be full body eligible as long as all of the MRI conditions are carefully followed. Now let's take a look at other important active implants, cardiac devices. There are several possible MRI issues that exist for these implants. For example, patients with standard cardiac pacemakers or ICDs may experience serious problems in association with MRI exams due to a variety of factors, including possible movement or rapid vibration of the pulse generator, excessive heating of the leads, temporary or permanent modification of the function of the device, and electromagnetic interference, or EMI, causing unwanted stimulation or arrhythmias. In consideration of these problems, standard cardiac pacemakers and ICDs are generally considered to be strictly contraindicated for patients referred for MRI exams. However, there have been many reports of safely performing MRI procedures in patients with standard cardiac devices under highly specific conditions and with careful physiological monitoring being used, as well as with other safety policies and procedures being followed. Because of recent advances in cardiac device technology, along with a better understanding of MRI issues that impact these active implants, several MR conditional cardiac devices are now available for patients from various manufacturers, including Medtronic, St. Jude Medical, Boston Scientific, Biotronic, and Sorin. So now you've seen several examples of MRI information for a variety of implants. Keep in mind that information exists for thousands of different biomedical implants and devices as well as for patient support equipment that has undergone testing for MRI issues. The MRI labeling information may be found at the respective manufacturer's website, or you can visit MRIsafety.com. Another important safety topic that I'd like to cover is patient monitoring in the MRI setting. Monitoring is indicated for a variety of reasons, including for patients who are physically or mentally unstable, for critically ill or high-risk patients, for patients who are sedated or anesthetized, and of course for patients who are undergoing MRI-guided procedures or interventions. Conventional monitoring equipment and accessories were not designed to operate in the harsh MRI environment where the electromagnetic fields can adversely affect or alter the function of these devices. Because of the potential problems that exist, MR conditional monitors have been specifically developed and tested for use during MRI. This specialized equipment includes EKG monitors, respiratory and apnea monitors, temperature monitors, as well as multi-parameter systems capable of recording several different physiological parameters. Healthcare professionals with appropriate training and experience are the only individuals permitted to perform patient monitoring during MRI. These healthcare professionals should be well acquainted with the operation of the monitoring equipment and accessories used in the MRI setting and be able to recognize equipment malfunctions, device problems, and recording artifacts. In addition, these healthcare professionals must be properly trained to identify and manage adverse events using appropriate equipment and procedures in the MRI environment. In addition to the content of this program, I invite you to review the many other topics pertaining to MRI safety and patient management that are presented on the website, MRIsafety.com. The safety info section of this website has information for more than 150 different topics. In addition, MRIsafety.com has information for thousands of implants and devices, and the content is reviewed and updated on an ongoing basis. My email address is also provided on the website so that I can quickly respond to your questions, especially if you have a question about a specific patient situation. In closing, please be advised that the content of this program does not replace the particular policies and procedures that may exist at your facility. Nevertheless, it does provide you with extremely useful information that will help you to create and maintain a safe MRI setting. It is important for all healthcare professionals to regularly review and update their policies and procedures using the latest information pertaining to MRI safety. Keeping yourself, your staff, and your patients safe is easily accomplished with proper training and attention to detail. Let's all work together to maintain the good reputation that MRI has achieved as an important and safe diagnostic imaging procedure. Thank you.
Okay, thank you, Dr. Shellock. At this time, we will begin the Q&A session. We ask that all of your questions be relevant to the information contained in today's webinar. Questions about accreditation should be directed to IAC by phone or email following the webinar. From IAC MRI, I'd like to introduce Corey Mabry, IAC Director of Accreditation, and Corey will be assisting Dr. Shellock with the Q&A session today. Corey, would you like to start us off?
I would. Thank you for the introduction, Kelly. But before I begin, I just wanted to touch base on two small items. I want to bring your attention to the questions panel that's located on the left side of your screen. That's where you would initiate your questions. And keep in mind that we do have a limited amount of time here today, so if we do not answer your questions now, someone will be in contact with you soon. All right. With that in mind, I'd like to go ahead with the first question. Does the continuous exposure to the magnetic field cause fatigue to the technologist?
Yes, thank you for that question. There is no evidence that exposure to the powerful static magnetic fields used for MRI cause fatigue to the MRI technologist based on studies that have been done where they've been examining the chronic exposures of the static magnetic fields to healthcare workers. None of that data demonstrates that in any way, shape, or form do the field cause fatigue to the MRI technologist or anybody that remains in the room during the operation of the MR system or for positioning or for managing the patient.
Great, thank you. Next question, is jewelry made of gold a serious burn threat?
So with regard to the threat of burn from metallic objects, jewelry that is made of gold is a potential problem because, as we well know, metals, even if they're non-ferromagnetic, can heat up, especially gold is a good conductor. So the standard of care when managing patients is to remove all metallic objects, particularly items that may be in contact with the transmit RF coil, and that's the best way to ensure safety for the patient. So basically, anything that's metallic, whether it's gold or not gold, if it's metallic, it's a good conductor, and it could heat up and potentially burn the patient, and you need to manage the patients accordingly.
Good, thank you. Next question, do you think there should be a limit on how many MRI exams are performed on a patient in one day? For example, do you feel that it's safe to do maybe 4 MRI exams on a 3 Tesla scanner?
Yes, well, because of the nature of the fact that MRI involves the use of non-ionizing radiation, there's no concern about cumulative effects of exposure to the electromagnetic fields used for an MRI procedure. And as such, it does not matter how many exams are done on a patient, regardless of the field strengths that are used in the clinical setting. And so to specifically answer your question, it would in fact be safe and acceptable to scan a patient at 3 Tesla, and doing 4 MRI exams is not out of the question.
A great answer. Thanks for that information. Next, how should patients who are unable to complete the screening, for example, if they're confused or, say, unresponsive, be handled when there is no family available?
Right. This is an important question, and there should be a policy in place to handle patients that are either poor responders or poor historians, or, let's say, in a coma or unconscious, that are referred for an MRI exam. And this should be something done in conjunction with your medical director to have a policy in place whereby you look for evidence of scars that could lead you to the fact that there may have been a surgical procedure with an implant placed in the patient, and start looking for evidence of some of the more problematic implants. So, for example, aneurysm clips or cardiac pacemakers or any active implant that might be present in the patient. And this can obviously be done by reviewing prior x-rays if they were done in close proximity, or other imaging procedures if they were done in close proximity to when the MRI exam was ordered. And so, as with many situations, when it comes to screening, there's going to have to be an individualized response based on the nature of the need for the MRI and consideration of the risks that are potentially there, as well as the benefits of the MRI exam for the patient in question.
Okay, great answer. Thanks for that information. Next question, is there a minimum time limit for post-surgical clips? In other words, is there a wait period before they should be scanned?
So this is a good question because there's a lot of confusion about when to use MRI in the post-surgical period. If an implant is a passive implant and it's non-magnetic or even weakly magnetic, for example, certain orthopedic implants and certain clips or vascular stents, you can scan the patient immediately after those implants are placed. There's no reason to wait a post-surgical period. There are certain hemostatic clips that are placed through an endoscope, and there is a recommended wait time in those instances. So it comes down to what specific clips are present in the patient or what specific implants are present in the patient. But in general, it's a non-magnetic or weakly magnetic implant during the post-surgical period, and if it's a passive implant, you can scan the patient immediately at 3 Tesla or less.
Okay, great. Thanks for the information. Next question, are medical patches an issue on a 0.3 Tesla scanner? Would they pose a problem?
Yes, regardless of the field strength. Now remember, the field strength is going to have a different transmit frequency. Regardless of the field strength, medication patches that have metal, that's really the key aspect of it. If there's metal foil present, then you have to manage the patient accordingly, whereby if that metal-based patch is within the transmit RF coil, you have to consider that substantial heating could occur, and you have to manage the patient accordingly. There's specific guidelines for managing patients with medication patches posted on the MRISafety.com website, and I encourage you to take a look at that information. and included in your policies and procedures at your imaging centers.
Okay, great. Thank you. Next question. We've heard of some new clothing coming to the market that has metallic threads, like Tommy copper, and perhaps some other materials. Is it a good practice to remove all the patient's clothing, including undergarments, to ensure the patient is safe?
Right. There's been at least one report of a patient wearing a sports shirt that had some metallic properties. So in some instances, copper or silver nitrate or other metal-based aspects of the materials are being utilized in standard clothing, and it is possible that these things can heat under certain MRI conditions and cause a problem or even a burn in the patient. I've only seen one report to date, but as a standard, as I mentioned in my presentation, the best thing to do and the best way to prevent problems is to make sure that all patients and research subjects are placed in gowns or scrubs that do not have pockets. And that will go a long way as far as helping to ensure patient safety, especially since we're seeing more and more clothing items, including underwear and socks, T-shirts, and pants with some metallic aspects present.
Great answer. Good information. If there is not enough room to insert pads or some type of cushion in between the patient and the coil, what's your feeling there? Should the exam be canceled to avoid burns, or what's your stance on that?
Right. So this is an important question to have an understanding of, and as I showed you in my presentation, direct skin and transmit RF coil, and that includes the body RF coil, contact situations have been responsible for some serious burns in the MRI setting. So if you cannot properly shield the patient using insulative material, and that includes even an air gap, you should not force the patient into a situation where there's direct skin transmit RF coil contact. Maybe consider using a larger bore size, referring the patient even to a so-called open or wide bore MR system in order to ensure safety and help prevent overheating or burn situations from occurring.
Great answer, thank you. Next question, is it safe to enter the static magnetic field while pregnant, say for a pregnant technologist?
Right. I didn't have time to go over that particular topic during my MRI presentation, but there's a whole section on the MRISafety.com website that addresses the pregnant healthcare workers. And in fact, an epidemiological study was done many years ago that basically demonstrated that there are no issues for pregnant technologists or other healthcare workers working in and around the MR system. But what's important is that those individuals do not enter the bore of the scanner, for example, to help manage the patient or have any contact with the patient and be in direct exposure to all three of the electromagnetic fields. But the limited static field exposures that occur during positioning the patient and setting the patient up for an MRI exam, based on the studies that were done, this epidemiological study in particular, which demonstrated that we have a good margin of safety with regard to pregnant healthcare workers working in the MR setting.
Great. Good answer. Thanks for that information. Now, titanium implants have historically been approved and have been considered safe. And the example on one of the slides with the cervical spine and the external device, which had titanium supports contacting the patient's skull, and that patient got burned. Can you please explain the reasoning behind the difference of safety between titanium implants and titanium external devices?
Right. Well, really, it's not a matter of an implant versus an external device. Titanium is acceptable from a magnetic field interaction consideration because it has very weak magnetic field qualities, as it's been demonstrated when we've done testing at 3 Tesla, 7 Tesla, and even 8 Tesla. But the concern for titanium is the fact that it's a great conductor, and so heating needs to be taken into consideration. And that includes possible heating for internal implants, orthopedic implants that can be quite large and made out of titanium. And if that implant is within the area of the transmit RF coil, you have to give careful consideration that substantial heating can occur and potentially burn the patient. So going back to that case where the cervical fixation system was presented, it wasn't just the fact that it was an external fixation system, but the fact that titanium is a great conductor, and that was in part responsible for that particular burn. But that could happen whether it's an implanted titanium implant or an external fixation device, as was shown in that particular case study.
Great. Thanks for that explanation. Next, I've heard that all vascular stents are okay up to 1.5 Tesla regardless of the implantation date or the product. Have you found this to be true?
Well, so this is an important point. So the labeling, as I indicated, is not simply MR safe or okay, as it was suggested in this question. It's MR conditional, and the conditions have to be followed to ensure safety for the patient. Of the stents that have been tested to date, I know of no vascular stent that's unsafe for a patient at 1.5 Tesla or less. And in fact, that's the case even at 3 Tesla. The problem is you can't simply have a general guideline for managing these patients without having a specific policy in place, because at some point there may be a stent or other vascular implant that will be unsafe for a patient for reasons that may be based on the fact that it could have a transponder or different materials are used or what have you. So if a general statement is going to be made, it's going to have to be made by your medical director with a strict policy in place that has the details under what circumstances that the stent is acceptable for the patient, whether it's at 1.5 or 3 Tesla, and also have a mechanism in place that if and when an implant, such as a vascular stent, does come out that's potentially unsafe, you have a way of identifying it to ensure safety for the patient. In my mind, if I'm intimately involved in testing implants and devices, I would find it surprising that we could have a potentially unsafe stent that wouldn't have such notoriety that the information would quickly spread to the MRI community. So hopefully that's the case. But it is important that if you do elect to have a policy in place for stents or any other type of implant, that it's a strict policy. It's developed by your medical director with MRI safety training, and everybody is on the same page about how to manage patients with stents that you may not have information on, but you might want to scan the patients.
Great. Thank you for that information. We have time for one more question. And Dr. Shellick, you had a lot of slides that had external fixation devices. Is there a waiting period associated with those? How long should you wait to scan those?
Right. Well, so as I mentioned previously, the waiting period is only based on a situation if there's some magnetic qualities and the device could be moved or dislodged for passive implants. And for the vast majority of external fixation systems that exist, those are made out of non-magnetic materials, and you can scan them immediately as long as you're following the MR conditional labeling claims. Some of the external fixation devices, though, are unsafe because of the material that's used or because of particular configuration that's present. So that's something that has to be taken into consideration. But in general, if it's non-magnetic, it's not going to pose a problem for the patient with regard to movement or dislodgement, but you have to consider eating as a potential issue.
Okay, great. Thanks for all this helpful information, Dr. Shellick, and at this point I'd like to turn the presentation back over to Kelly Bair.
Okay, great. Thanks, Corey, and thanks again, everyone, and a special thank you to Dr. Shellock for his presentation today. Please feel free to contact IAC with any questions that were not answered during the Q&A session. To receive continuing education credit for attending this webinar, please complete the survey. The survey will appear on your screen automatically at the conclusion of this live session and also be available from the IAC Pro Libraries website for 3 business days. In the upper left, you'll click on My Webinars. Look for the title of this session, MRI Bioeffects, Safety and Patient Management. Beneath this title, you will see the link Take Evaluation. Click this link to complete the survey. Your certificate can then be accessed and printed from the very next screen and any time thereafter through a new link on the My Webinars page called View Certificate. If you have any questions about the survey, please contact us at webinars@intersocietal.org. Once again, we thank you all for joining us today and appreciate your participation.